We start with the rush of travel for the holiday season, coming at the same time as the Omicron COVID-19 variant, now accounting for nearly 3/4 of all cases. You might want to freshen up on current public health guidance. KXAN'S Monica Madden explains what you need to know before jetting off.
It's the week before Christmas, and of course the airport is busy. We already spoke to several people who missed their flight despite getting here hours early, and that's not the only threat to travel plans. Of course, we have the Omicron variant, but despite that, it's not leading to people canceling those holiday travel plans.
Well, we have our vaccines, and everybody we're going to see is vaccinated.
I can't live my life in fear.
Whether you're nervous or not, healthcare experts say it's crucial to evaluate your plans to make sure you keep yourself, your family, and other people safe while traveling. Do you know what current guidance is right now for if you have been exposed?
I don't know specifically, but
for 48 hours from before the time they started having symptoms is when the sort of clock starts for when they could be infectious.
If you learn of an exposure and are planning to travel, you might be okay to continue if you are vaccinated, and better yet, if you are boosted. For those who are inoculated, they should still monitor their symptoms, get tested in the 5 to 7 days following the exposure, and continue to wear a mask in public settings.
They should probably still get tested, but they don't necessarily need to quarantine specifically. And certainly if they start feeling sick, they should isolate and stay away.
Physicians say unvaccinated people should not hop on a plane or drive to see their grandparents if they've been exposed.
It may be unfortunate, it's uncomfortable, we haven't seen our family and things like that. If somebody is unvaccinated, they really should quarantine even after just an exposure.
Lastly, if you are fully vaccinated, still test positive but feel okay, experts still recommend that you stay home until you test negative. But the best practice for everyone remains get the booster, wear a mask when you're in public, and stay home if you feel sick. In Austin, Monica Madden, back to you.
Hospitalizations have increased quickly enough in North Texas that the Dallas County Health Director advises against travel there if you are unvaccinated. According to the University of Texas Southwestern, Dallas County COVID-19 related hospitalizations have increased 6% in the past 2 weeks. In Tarrant County, which includes Fort Worth, it is 13%. In Harris County, where the Omicron variant first appeared in Texas, officials there just increased the alert level. They're calling on unvaccinated Texans to minimize all contacts. Harris County, which includes Houston, just reported the first death connected with Omicron. Here is a current look at the chart of the average number of new COVID-19 infections and COVID hospitalizations. You can see how the number of new cases is starting to spike while hospitalizations remain behind. A similar trend happened in the spike that we saw in the last winter period. Today, the state of Texas reporting just under 9,000 new confirmed cases. That is the most in a day since early October. There are more than 3,000 COVID patients in Texas hospitals right now. The number of hospitalizations has remained relatively consistent for the last 2 weeks.